Hey guys, welcome back. Today we're going to be talking about something that frustrates me and many doctors to no end, and that is when a patient can't complete their recommended treatment. And the reasons we're frustrated are not what you think. Unfortunately, many of these patients get labeled as non-compliant, and that puts the blame on the patient rather than the system for their non-compliance or their inability to complete a treatment program. We're going to talk about one of the ways that doctors and patients can help improve compliance and adherence so that patients actually get better and don't waste so many healthcare dollars. I'll see you after the break. This kind of scenario happens to almost every doctor. You have a patient coming back into the clinic and you sit down and you ask them how they're doing with the prescriptions or the recommended treatment that you gave them last time, whether it was 4 or 6 weeks ago. And the patient says, I didn't pick up my prescription. And then you have to ask why. And so often the reason is because it was too expensive. And this should not be happening, especially with generic medications. So I want to talk today about 3 different ways to make it easier to access your prescription medications, specifically for dermatology patients, but there's tips that will be helpful for patients in any type of practice setting, whether it's family office, whether it's any other specialist that may help improve access and affordability for the medications that you're being prescribed. It's probably happened to everybody where you take your prescription into the pharmacy and they run it through your insurance and they come back and tell you some exorbitant price that you just can't afford. And there's a lot of things that go on getting to that point. Many doctors, myself included, always try to prescribe generic medications as long as it's appropriate. Generic medications are off patent and can be made by any pharmaceutical company. And these tend to be a lot less expensive than brand name medications that are still under patent. But over the last few years, we've seen even the price of generic medications skyrocket. So I have routinely heard from patients coming back to my clinic that generic medications that used to be only a few dollars, things like clobetasol, things like econazole or fluconazole, antifungal medications, topical steroids, anti-itch medications, that these are now costing $90, $150, sometimes much more for the generic counterparts. And a lot of times what happens is that the insurance company for the patient and the pharmaceutical manufacturer, and sometimes what's called a pharmacy benefit manager, use negotiations to set the price of certain prescription drugs. Now, overall, the goal of a pharmacy benefit manager is to negotiate those prices on behalf of the insurance company for the drug company. But what sometimes happens is that they take quite a big cut out of those negotiations. And for example, we all know and have heard that the price of insulin has gone up like crazy over the last few years. Well, the price that the pharmaceutical companies have been charging has only gone up a small amount over the last 10 years. But the price to the consumer has gone up like crazy. Part of the reason for that is the pharmacy benefit managers have now come in and they are increasing the price quite a bit. So they're essentially helping to buy that medication and then resell it to the pharmacies at a much higher price. So in the end, the insurance company is having to pay more for that because the pharmacy benefit manager is taking a cut. And so there's pros and cons to those pharmacy benefit managers, but when your price of medicine goes up, it's ridiculous.
$1 million.
So when you pick up a medication, your insurance company has a negotiated price that they will pay the pharmacy for that. And that's why if you have a high deductible plan and you're responsible to pay out of pocket for all of your medication costs, you have to pay according to the contracted price between the pharmaceutical company and your insurance company. So one example that I had happen in my clinic recently is that I prescribed a medicine called mupirocin. It's a very common topical antibiotic, and it's used for things like impetigo or just common infections on the skin. And a patient came back and said, that medicine cost me $23. Now, I purchase mupirocin in my clinic and I dispense it to patients who need it who potentially can't afford it. And I know that I only pay $3 for mupirocin when I buy it in bulk. So the negotiated price between this patient's insurance company and the pharmacy, the drug company, all of that was $23, which is ridiculous. That's a $20 markup. And I know that these pharmacies are getting it for even less than that because they're buying so much more of it. So the patient paid their copay, they got their medicine, and $23 is a lot to some people and maybe not so much to others. For this particular patient, it wasn't that big of a deal. They didn't call the office, they didn't ask for an alternative. But what can you do if that's the situation you find yourself in, where they've run your insurance and now the price is ridiculous? It's way too much for you to pay. The first option is a service called GoodRx. GoodRx is a coupon card that you can obtain for free, whether it's on your phone or you can get a card sometimes directly from your doctor. And in some circumstances, they might even be sitting at the pharmacy. And you can use that card and ask the pharmacist, please don't run that through my insurance. I'd like to use GoodRx. This typically only works if you're paying cash for the prescription or you have commercial insurance. You cannot use these kind of cards if you have a government insurance like Medicare or Medicaid, just because of the way that the rules are written and the guaranteed no negotiation price that Medicare and the federal government has with pharmaceutical industry. Oftentimes, if you use your GoodRx card, it's going to bring the price down to a much lower cash pay option. That prescription then does not apply to your deductible, but if you have a very high deductible and you don't routinely meet your deductible year after year, it may make sense not to use your insurance to buy a prescription if you're going to save $20 to $100 on that particular medicine. GoodRx is a service that does capture information, so they are a profit-making venture. They make money by the advertisements on their website, and they do get a small percentage of each prescription that is filled using their service. However, I think despite their data collection, GoodRx remains a very viable alternative for many patients who would like to bring down the cost of their generic medications at their local pharmacy. A second option to bring down the cost of your prescription medicines is to use local pharmacies that are not part of large retail chains. In many ways, places like Walgreens, Rite Aid, CVS, they've made things much more accessible and more affordable, but they don't have a lot of incentive to negotiate those prices down for the individual consumer. And they oftentimes, in my experience, have been resistant to run manufacturer coupon cards. And that's a whole nother issue that could be problematic, but we're not going to get into that today. Local, independently owned pharmacies often will work much harder to get you that medicine at a better price because they need each and every customer that comes through the door in order to stay profitable. They can't depend on profits from a huge chain of stores in order to keep their lights on. So they'll work hard to do things like run coupon cards to find the best source for generic medications so you can get them at inexpensive prices. So if you routinely go to a large chain pharmacy and your prescription drugs are getting too expensive, ask your doctor if a local independent pharmacy might be a better option for you. We routinely send our patients to local pharmacies here in Boise, Idaho, places like Custom Medica and Portico Pharmacy, Medicap. Those are smaller, independently owned, and they work really hard to provide excellent customer service, and they get our patients medications at lower prices. Some of these pharmacies will even do compounding. Compounding is the practice of creating a custom formulation for an individual patient, and oftentimes they're able to replicate to a high degree of similarity the medicines that I'm prescribing. For example, one common medication that we prescribe for rosacea is a cream called Soolantra. The active ingredient in this cream is ivermectin, and that has been in the news a lot over the last year, but ivermectin topically applied to the skin can be helpful for many patients for rosacea. But Soolantra is currently a brand-only medication. There's no generic alternative. However, compounding pharmacies are able to compound ivermectin into a cream that the patient can purchase, and sometimes they'll even mix it with other active ingredients like metronidazole for our patients, and the patient is able to get that down to a price of maybe $30 to $60 depending on the pharmacy and the size of the tube. And so that compounded medication from a local independent retail pharmacy, it can be a great way for patients to save money. So if you can't use GoodRx or you have a local independent pharmacy that you can support, ask that your prescriptions be sent there. You're often going to find that prices will be lower. And option number 3 is my personal favorite. If you don't have a local independent pharmacy that you like to use, you can ask your dermatologist to use a service called Skin Medicinals. Skin Medicinals is a custom compounding pharmacy that is certified to every standard that they have to be certified to, and they will ship the medication to you from their pharmacy. Your doctor is able to send a prescription to the Skin Medicinals pharmacy through their portal, and they have nearly all of the custom compound topicals that we use in dermatology. I like them because they have great customer service. Their prices are transparent. They get it shipped to my patients very quick. Patients can go on and make their payments there. There's no kickbacks. There's no financial relationship from your doctor to the pharmacy. That's illegal to do anyway. So you're able to go and request refills and have a very nice interface and pay a transparent, straightforward price for your medications. They come in a great vehicle, and I have many patients using the Skin Medicinals service. As a bonus, Skin Medicinals is invested in the success of dermatologists and dermatology patients. They routinely make large donations to causes that support patients with skin disease. So when you request that your prescriptions be sent to a place like Skin Medicinals, you're contributing back to the dermatology community, to patients that suffer from skin disease, and lobbying efforts to help improve the price of prescription drugs. So I highly recommend Skin Medicinals if you don't already use a local compounding pharmacy. I hope those tips are helpful to you to bring down the cost of medications. If you're able to get your medicines, you're able to use them, and your health will improve. This is going to help to improve compliance for patients, and it really shows that the blame for a lot of non-compliance is on the system and not on the patient. As doctors, we have to avoid blaming the patient. We have to make sure that we're educating well, that we're helping our patients to access their medications so that they can use it successfully. Let me know if you guys have other topics in the healthcare system that you want me to cover, and I'll look forward to coming back and sharing those with you next time.